I'm Dr. Nitin Chowdhury, and on behalf of the CANPAT committee, the following is a summary of the 2020 survey's key points. As many of you know, the CANPAT survey is now in its 5th year, and as we head into our 6th year, we hope that the information provided is meaningful and applicable to your clinical practice. Shifting gears to retinal imaging, the role of OCT angiography was evaluated in our clinical practices, and our respondents indicate that many of them do have access to OCT angiography, and there's a growing utility of it in their clinical practices in retinal pathologies in general, as well as in select circumstances, with over 2/3 of respondents using OCTA. When looking at this more specifically, there are a variety of different disease states which this technology was being utilized, everything leading with wet macular degeneration, central serous retinopathy, and CNVMs from miscellaneous causes. As we begin to explore the role of nascent CNVMs, we will see likely that the dry macular degeneration utility may begin to evolve. For which of the following retinal conditions do you find this most helpful? Again, primarily CNVM from miscellaneous causes and wet AMD were the leading answers amongst our members. And finally, when looking at diabetes and confirming the presence of PDR, members still lean heavily on fluorescein angiography over OCTA or OCT, and this was borne out in the numbers, with OCTA being at about 12.9% overall relative to fluorescein angiography.
When asked which anti-VEGF agent they believe treats the broadest range of wet AMD patients, 2/3 of participants chose aflibercept, while 20% chose that all 4 listed agents are about the same. When asked how likely they were to use brolucizumab in patients with wet AMD if the drug was covered by their provincial drug plan, 45% chose patients that could not be extended beyond the 4-week interval, and 40% chose that they do not plan on using the drug at the current time.
Now turning to the surgical questions from the CANPAT survey, participants were asked, what type of anesthetic do you utilize for the majority of your uncomplicated vitrectomies? Responses to this question were fairly evenly split between topical with cut-down and subtenons anesthesia by blunt cannula and classic retrobulbar anesthesia performed by the surgeon resident or fellow. General anesthesia was rarely used in these cases. In keeping with the same theme, participants were asked, what type of anesthetic do you utilize for the majority of your complicated vitrectomy cases? And examples of complicated cases were given. Responses showed a clear preference towards classic retrobulbar anesthesia performed by the surgeon, fellow, or resident, and some respondents utilized general anesthetic in these cases approximately 20% of the time. In questions related to macular hole surgery, participants were asked, when do you perform an ILM flap or ILM transplant? These responses clustered around more complicated cases in larger macular holes who had failed surgery, and macular holes that had opened after successful surgery. 30% of respondents did not use ILM flap or ILM transplant as a surgical technique.
When asked, when do you plan to retire from full-time clinical practice, approximately 20% of respondents said they plan to retire within the next 5 years. Why is this important? It's important because this is the number of retina specialists that we need to replace the retiring individuals. 4% of Canadian retina specialists plan to retire each year. Out of 120 retina specialists who currently work in Canada, this means approximately 5 will be retiring each year. From an annual occupational replacement number, this means we should be training 5 retina specialists in our fellowship programs to replace those that are retiring.
The CANPAT 2021 survey will be released in December. Please feel free to fill it in at your earliest convenience. So we'll have the new updated results for Canadian retina specialists. Thanks so much for your time, and look forward to seeing everyone virtually at the upcoming CRS meeting.